All right, Heather, so we've just completed the information gathering piece, and I'd like to review your perio charting readings with you. Is that okay?
Yes, yes.
Do you remember anything about your periodontal pocket depths from your previous dentist?
I know that they were numbers similar to what I heard today, actually.
Okay.
Something like 3s and 4s and even a couple of 5s.
Okay. Do you know what they were before they did the scaling root planing therapy?
I can't be really sure,
Okay.
but I think I had some 5s and 6s maybe.
Okay.
I don't really remember.
Okay, and that's okay. But yes, you heard correctly in today's visit that you do have an area on the upper right where you have some 5mm pockets. Do you understand periodontal disease? Tell me what you understand about periodontal disease.
Well, I know that it's a disease of the gums and that there's some infection in the gums. And if the probing the numbers are too high, that can be a concern.
Very good. That's excellent. That's a great question. And I'm just going to piggyback off of that by saying it's not just in the gums, but it's in the complete supporting structures around the tooth. So it also can influence the bone that's around the tooth and also can be systemic.
Oh.
So
what does systemic mean?
In your bloodstream.
Oh.
And it can cause other ailments such as cardiovascular disease. It can contribute to, preterm labor, low birth weight in
Well, I'm not
women.
having any babies.
Well, that's good. That's good. But that's a way that is systemic.
Okay.
So that's how the oral health can influence other areas of the body. So it's good that you're here today. It's good that your motivation level is up to an 8 and a 9 about your oral health. So the best case scenario for you is to have the deep cleaning, the scaling and root planing therapy, again, on the upper right.
I just had it 2 years ago. Do you think I really need it again today, or for the whole mouth, or?
Well, we wouldn't do it just on the whole mouth, just that area where we're seeing some active signs of infection.
Okay.
And the other areas we would do your maintenance cleaning.
Okay.
But to go back to answering your question, and if I understand correctly, is that you want to know why, again, you have to do this therapy.
Yeah.
Yeah, and that's a common question, and one that we recognize. It's important for you to understand that periodontal disease can come and go. It can be kind of like a cold sometimes, where you're really, really healthy at one point when you come to the dentist, and then depending on outside factors such as stress or nutrition or home care, we'll see some areas flare up.
Oh, okay. Okay.
So if we don't treat it and it continues to flare up, it can move to other areas of the teeth, and potentially you could lose the teeth.
Mm-hmm.
So with knowing that, on a scale of 1 to 10, how motivated are you in treating this area and treating this infection?
I'm very motivated. I'd say 10. I'd like to, certainly don't want it to get worse.
Right. Good. Awesome. Well, I'm here to help you through that process. So let me input some stuff.